Otherwise, we might say, well, Andreas, let's stop talking. Let's go and do whatever happens, and then we're going to get the pain you got, and eventually we're going to be happy like you and go and give lectures around and say how. I mean, the reason we're doing this is to avoid this incredible pain and do it more efficiently, faster, and to be content, if possible, even from today. Yes, I say to my students sometimes we need to do some things that we are not happy, you know. A lot of students take chemistry, they don't like chemistry, but they want to become medical doctors. How can you go through this? If you are not going towards medicine from within, the driving force comes from within, you will give it up. Most likely you will give it up. The first C and this, that's it. They say I cannot do it. Or even if you don't do it now, you will give up during medical school, right? But if you have something that you love and it's in your heart, it doesn't matter what obstacles you will fail, you will see, you will just go through. Because that driving force is the one that carries you through, you know? So the career in medicine, we already covered that, should be coming out of compassion, out of unconditional love for human beings. And if not, that is not there, eventually it will crush you. It will crush you, you will not be able to do a good job for other people, and you will be crushed. You might be going with a nice car and have a good salary. Your wife, your husband is going to be miserable next to you. You will suffer because you will not be a happy person, okay? And whatever misery you see in your job because you compete perhaps with people that they are there because they belong to that occupation. How can you compete with a medical doctor who is all the way in his heart to be a medical doctor? And you are there because you wanted to make Papa and Mama happy. How can you compete with a medical doctor? He's going to be the star, and you will be always following him and being jealous. And when you go back home, you will be grouchy to your wife or to your husband. Yes, that's what's going to happen. So you got to be very careful. You know what you want to do and why you want to do it, and then you will be a star. Because whatever you choose, be in medicine or whatever it is, you will be a star. Whatever you do. So, questions. Before you come to a point to feel the need you have to change your career when you are 40, 50 years old. There is 3 questions that you need to ask now before you go into that point, because then it's harder. It's very hard. You have a wife, a husband who has a job, kids in the school. It's not going to be easy to give up your job and do something else like I did. It's not easy. It's very hard. There is not many people that have the courage to do it. That's true. You know, it's very scary. Believe me, it's very scary, and sometimes your husband or wife will tell you, you know what, I married you to have this kind of job and this kind of life, and don't move the boat. If you do, I don't want you anymore. It can happen that way. So you got to start building your house with a good plan, right? With good rocks, right? Put them in the right way, so when there is wind or thunderstorm, it will stand. Is it possible to find and create work with purpose and passion and still earn a good living? Absolutely. And if you read that book I suggested to you, will see that it's true. But always remember this. What dreams will you abandon to make a living or try to make others happy? You got dreams. Inside your heart there are dreams. Maybe they have been suppressed by teachers, parents, fear of the society that there will not be these kind of jobs tomorrow, whatever. You cannot abandon your dreams. You cannot abandon your goal. If you really believe that's what you want to do, you cannot abandon it for anybody else, for any other reason. So the question is, what is your true skills? The ones that will bring you the most fulfillment while benefit others. You have to realize what your skills are. I want to finish with this. It's all things that we said good. They are very useful. And a lot of things, when you follow them, you will have a good benefit. But you know what? Sometimes we come to the point that we don't have the strength to do things, even though we know they're right to do. And in my life, I've discovered that unless we surrender and we accept a higher power than ourselves, we come to the point many times, if not almost all the time, we crash. And that power comes by accepting a higher power than ourselves. Okay? And that's up to each one of us to discover that higher power than ourselves. Just about January 7 on Pittsburgh Post-Gazette and January 12, just a few days ago, the New York Times, there's articles about Troy Polamalu. He's a very famous football player, right? He talks about realizing and surrendering to that higher power than ourselves and how much strength he gets from that. I would say that this is the most important move to do, to really connect with a big battery. There is a big battery out there. We are limited. We can try as much as we want by ourselves. If we do not connect with that incredible, infinite power battery, we cannot go and do much. We are basically alone, and things will not work for us. If we surrender to that bigger power, wisdom comes, right decisions are happening, strength is there. You will have a life that is going to be incredibly beautiful, and that life and light as medical doctors will spread to the people that you will serve, the patients, which will need that kind of light. Because imagine if you're a medical doctor and you become nervous, or you become fearful, or you become nervous, or you're not sensitive. How are you going to avoid all these situations? Because we are limited when you do not trust everything you will do as a medical doctor to that higher power than yourselves. And without that belief, without that establishment, believe me, you will face this situation, which I will describe in 2 minutes, and then I will close. You will come to a point that you will know, I can heal this person by following this method, and this, I will give this herb or whatever. There are many ways to heal a person. And you will know that I can do it this way, but if I tell that to my patient that he can be healed this way, I might lose my job. That's going to be a point that you will have to decide, and if you don't do the right thing, you will be miserable all your lives. You will not be a happy person. You will be crawling down like a worm. You will not fly like an eagle. There are many ways to heal a person. There's this way, a person to be healed from a certain disease, that one, and that one. You should be able, when you have that strength, to do the most efficient, the less painful, and the least expensive way for your patient. And if you will not do it, but you have by fear to do the opposite, then you're not a medical doctor. You are actually a problem to society. So what I wish from my whole heart, we need medical doctors to be ethical, to be compassionate, and I know every young person who comes to my office, they truly say and believe it. I want to help people, and I don't believe they fake it. I don't believe that at all. All young people have a desire who wants to become a medical doctor. They want to help people. But when they go into the system, they become fearful, they start forgetting what they believe, and they start doing what is wrong. And this country and the whole world needs people of the new generation to have the courageous spirit to say no more anymore this way. We need to change things. We need us, the doctors, to have time for the reflection, to have time to rest, and not to use us like a lemon to squeeze all the time. Because if medical doctors give the service to people the way they do, they need their determined, they need their spare time, they need time for reflection, and they need time to rest. And it's absolutely nonsense to see them so busy and so squeezed, not only through medical school, but even after medical school. Why? Why this should be that way? When there's so many people that want to become medical doctors, there's so much need, There's so many people that are not serviced. Why this is so? You are the generation that you must be courageous enough to say to the status quo, we need to make changes for the benefit of all, for all society. Because if one part of the society, which is a big part, because the middle class is happening now to become the minorities, we're not talking about any more middle class. It's going to go and become pretty soon, almost is done, minority. You represent the most of the population in a minority way. And so you have to take these people. If these people are not going to be taken care, it's going to be trouble. And doesn't benefit anybody. It doesn't benefit the majority part of the society. It doesn't benefit the rich either. All of them will suffer, and they're suffering now. It's something that must be done. Okay, if Michael Moore brought that kind of movie out, you should see it. You should know what is happening. You should know reality. Because you must be informed how it is and what needs to be changed. If you do not know what it is, you will not know how to change it. And if you will not change it, the world will live tomorrow will not be better, will be worse. And it's up to you. Your responsibility is on your generation. These changes need to take place. They must take place. There is a lot of suffering out there. People don't have coverage. They are not covered. Even when they are covered, they are not covered the way they're supposed to. It's your responsibility to do this. This is a very rich country. How can this be that people will not have coverage? How is it that other countries, they have such much less richness and they are covering their citizens? Something needs to be changed. Who's going to do it? You, the young people. Not only for your sakes, but for the sakes of the status quo. Because the status quo needs your help. Because we become into a habit, right? And we cannot change things. We become habits, right? And needs young blood, fresh blood, tell us, hey, Dad, Mom, we need to make these changes. Otherwise, look, we are destroyed. We cannot do this anymore. We have to change things. So, I hope that this is going to be your positive thinking, your prayers, whatever you call it, that I wish you to become medical doctors, if that's what you want to do, and I wish you to have the courage and the strength to be an example out there in the world, to do it the right way, and to bring changes like Martin Luther King. Each one of you can do it, if you connect to the big battery. Otherwise, you cannot do it. And you find out what is that battery is. For me, I will not give any name to it. And with this, I wish you the best for your work.
Thank you very much, Dr. Toupadakis.
I don't know if you have any questions or if we have time, maybe we don't have time, right?
That resonated with a lot of us where we're at right now. Any questions?
Do we have time for questions?
A big thank you from all of us for taking some time out. Here, this will keep you up on those late nights reading some more geometry and math.
All right, thank you.
Under the chemistry.
Thank you.